Welcome to our attendees who have joined us today and to those joining via the recording to the North Simcoe Muskoka Specialized Geriatric Services practice short for June 2023. My name is Allison Jayawira and I'm one of the psychogeriatric resource consultants with the NSM SGS. We're pleased to provide our practice shorts through Zoom webinar. All participants are muted and your videos are off. Please note that there's a chat box at the bottom of your screen for you to share with other participants and a Q&A section where we ask that you write any questions for today's speakers. Please do not click on any links in the chat box unless they're provided by myself or by Kim Simpson. Today's session is being recorded and will be accessible on the SGS website. If you're watching the recording, welcome. And a reminder, if you'd like to join live, practice short sessions are offered the second Friday of the month at 8:30 in the morning. I wanted to take this opportunity for a land acknowledgement. We're gathering on traditional lands sacred to many Indigenous people. I'd like to acknowledge the traditional territories of the Anishinaabe, which include the Odawa, Ojibwe, and Potawatomi nations, collectively known as the Three Fires Confederacy, the Haudenosaunee and Wendat nations, and the presence of other First Nations, Métis, and Inuit residing in the Simcoe Muskoka territory. Most of us have come here as settlers, immigrants, or newcomers in this generation or in generations past. We're all treaty people. As such, we commit to collaborating based on the foundational assumption that Indigenous peoples have the power, strength, and competency that Indigenous people to develop culturally specific strategies for their communities. We're dedicated to honoring Indigenous self-determination, history, and culture, and are committed to moving forward in the spirit of reconciliation and respect for all First Nations, Métis, and Inuit people. Wanted to highlight that June is National Indigenous Peoples Month, and specifically June 21st is National Indigenous Peoples Day. Next slide, please. I'm very pleased to introduce Jordan Ladouceur and Nicholas Bruno, who are completing student academic placements at NSM SGS with a focus on learning about and implementing technology when working with older adults. Jordan Ladouceur is currently working on a postgraduate degree in public health inspection at Toronto Metropolitan University. Prior to this, she obtained her Bachelor of Health Science with an emphasis on public health. Jordan has worked in a retirement home setting for the last 3 years and has gained a passion in working to improve the quality of life for our older adults. She hopes to pursue a career in health inspection and work alongside the RHRA and the Ministry of Long-Term Care. Nicholas Bruno is a third-year business student at Wilfrid Laurier University. Nicholas has a passion for technology and grew up in a household that was very centered around passionate care of older adults. He volunteered at a local retirement home, running a program called Cyber Seniors, where he taught a group of older adults how to use their iPads in their day-to-day lives. This experience led him to start his own business called AL Technologies that focused on bringing new and unseen technology to people living in retirement homes. After completing his schooling, he hopes to continue this business. Welcome, Jordan and Nicholas.
So, when we are considering technology and its benefits for older adults, we typically lean towards technology that has emphasis on physical health alone. However, in today's age, the types of technology we have access to is incredibly vast, and because of this, we can consider a holistic approach to the introduction of technology in the lives of older adults. This focuses not only on physical health, but also social, mental, and spiritual health. Through the integration of technologies such as home safety devices, smart screens, and virtual reality, a sense of social connectedness can be fostered while also ensuring physical wellness. These are important key points to note when considering the health of older adults and their ability to age in place.
It's important for us to note that today we are going to be showcasing technology that's available presently, as well as technology that's up and coming in the future. Our hope is that you can find and see the practical applications of technology in your practices today and can see how that will translate to practically applying these devices in the future.
During the pandemic, it was evident that older adults and care partners are extremely resilient and can adapt to the integration of technology in an attempt to enhance their lives, and this still holds true post-pandemic. This being said, technology will continue to ease the hurdles of aging in place, such as functional and cognitive impairment, chronic disease, diminishing social network, and lower level of physical ability. This allows older adults to live independently for longer.
So we're going to start with technology for physical well-being. Firstly, we're going to take a look at wearable technology.
So looking at physical well-being first, there are many feasible options when it comes to integrating technology into the lives of older adults. Wearable technology is of security. This can be evident through the use of location tracking devices such as the Apple AirTag you can see on the left. Give them peace of mind. Individuals to track health levels such as blood oxygen levels, heart rate, irregular heart rhythms, and sleep patterns. They also have the ability to send out SOS notifications, and all of these recordings can be tracked from your watch and sent directly to your physician. There are many different brands of smartwatches. As you can see here, we have the Apple Watch and the Samsung. They're relatively similar in what they do. There's just a couple different price brackets.
Now, moving on to the future of wearables, the market looks like it's shifting to wearable biosensors, so that we have companies developing rings, patches, gloves, and some even developing tattoos. These sensors can track data regarding things like your sleep, hydration, and even ECG monitoring. In the future, these devices are set to track patient health info in order to give early diagnosis on disease, administer patient medication, and even perform basic blood tests such as Emily's tests or basic blood cell counts. The impact of these devices is that they're expected to reduce hospital costs by 16% by 2027. This will lead to an inpatient and outpatient cost reduction by an estimated $220 billion by 2037. This is because these devices incentivize behaviors that reduce repeat visits to the hospital. Studies show that 75% of people agree that wearables can help them engage in their own health. This leads to an estimated 25% reduction in patient follow-up costs. Next, we're going to move on to home safety technology. So the currently available home safety technology, on the very left, we have smart plugs. These are plugs that you plug into a standard outlet and they take over. They're voice activated and you can set schedules for different lights and appliances, and you can also shut off power from a distance. So if you're ever concerned that somebody has left a device on, left an appliance on, you can shut it off remotely. These can also be connected to security systems to turn on lights and alarms if motion is detected. Now, moving on to the Nest Protect. This is a smoke and carbon monoxide alarm that has a few unique features, such as a night light, a safety check, and a steam check. 9 contacts in the event of an emergency. You will be notified as soon as there's an emergency. Moving on to door alarms, there are 2 different versions typically currently. The first one detects when a door or window is open, but just makes an alarm. They're very simple to install, but on the very right, we see smart door alarms. These typically do the exact same thing as the standard door alarms, but instead of not only making an alarm when a door or window is sensed open, it will also send a notification to a device notifying the person that it's been opened. Now, moving on to the future for this at-home safety, on the right, you can see a device called Centenaire 2. This device would be more practical in an at-home setting. Basically, what it is a camera that uses motion capture to track individuals inside their home to detect falls or other emergencies early. It has a 24/7 access to an emergency hotline, so in the event that it detects any of these emergencies, it will notify the authorities. This can be used to provide care in a regular home or even a long-term care home. It has remote monitoring for people with chronic diseases or responsive behaviors. It can manage services of at-home caregivers. It can monitor restricted areas. And it even has a feature that where a resident or patient can seek help by waving their hands in front of the camera. This device can monitor activities such as sitting, standing, or laying down. Now on the right, we see a device called VIAR Care. Now this is a device that is designed to work in retirement homes and long-term care homes. It's very similar to the Sentinel 2 camera device, except that it doesn't have a camera itself. It uses radio frequencies to map out areas to detect the presence of individuals in order to detect their falls, when they're out of bed, when they're exploring or wandering, their sleep health, as well as their bathroom frequency. Now, the no cameras is great because it helps to preserve the dignity of those who require care. And as you can see in the graphic, all of the data gets sent to a centralized dashboard so you can see all of the residents and all of the patients at once. Now, the impact of this technology, strategic investments in these innovations can allow those living with chronic conditions to become more independent in their own home, remain in their homes for longer, engage in self-management of their conditions. Now, most importantly, the home safety technology can improve the quality of care provided, reduce the inappropriate hospitalizations and emergency room use, as well as enable the right care in the right place by the right person. Next, we're going to move on to technology for physical well-being.
So also considering health and wellness, timed pillboxes are a great way in which technology has benefited the lives of older adults. Through the ability to set timers on the pillboxes, individuals will receive reminders for when to take their dosages. There are a couple different types of pillboxes available with different dosage abilities. The most beneficial timed pillbox of note is the larger one in the middle. This is the Live Fine, which has the ability to hold up to 6 doses a day for 28 days. Smaller pillboxes, such as the one on the left, are great for those who have 1 dosage of medication a day. Though when considering the pillboxes, it's also important to look at the ability of the older adult, as dexterity plays an important role in the ability to open the cases. On the right, you see the Blink camera. So home cameras, such as the Blink, are also a great type of technology to install in the home to ensure safety. This can be beneficial not only to older adults, but anyone who wants to be able to check in on their home from a device. So cameras like these give the ability to see what is happening in any room from corner to corner. And through the use of these smart cameras, you can also get real-time motion alerts through your phone with an app. These are relatively affordable devices, and many different brands offer them at tech stores or Amazon.
Now, moving on to the future of this category, this is a device that I'd like to showcase called Pillow. It's just come out of its crowdfunding stage and is set to move into manufacturing. Basically, what it is it's a personal home health robot. It empowers people better to independently manage their own personal health. It uses facial recognition to tailor its performance to the individual. This device can answer your health and wellness questions, connect you directly with healthcare professionals, as well as manage your vitamins and medications by sorting them, dispensing them, and even ordering refills when you run out. The impact of this technology, automated pill dispensers can be used to improve adherence to daily medications, prevent patient overdose, give peace of mind to primary caregivers, as well as the technology designed for physical well-being can give some personal independence back to those relying on their personal caregivers. It can help to offer an additional layer of safety to those living independently. And it can also provide some layers of job relief to the personal caregivers as they don't have to take as much time sorting and managing medications. Next, we're going to move on to social technology. Now, I'm sure most of you are very familiar with these devices, the Google Nests and the Echo Shows. These are smart home assistants that can set reminders and appointments, set reminders for appointments and medication dosages. It uses voice control where you can ask it questions and receive verbal and visual answers. You can set alarms, timers, and appointments, make video calls, stream music and TV shows, and even set them up to be with other compatible smart devices such as lights. The Echo Shows have a drop-in feature where you can drop in to a person's device if you haven't heard from them in a while and pop up on the screen. It's a great way to check in on someone if you haven't heard from them. Now, moving on to the future of this technology, on the left, we see a device called LEQ. Now, this is the first ever proactive voice-operated care companion designed to empower independence. So unlike the Amazon Echoes or the Google Homes, this device actually initiates the interaction with you by asking you questions, by suggesting activities for you to do, such as taking a walk, and even providing reminders. This can act as a virtual assistant typical to the Echo Shows and the Google Homes, but it also provides daily check-ins and assessments of well-being. Now, looking on the right, this is a device that's a little further in the future. This is Aeolus Bot. It is a personal care robot designed for long-term care homes and retirement homes that can disinfect areas, provide care, make deliveries, and even patrol the building. Now, while we may not see this in practice here yet, it is already in practice in many Japanese care centers. It has the ability to use elevators and open doors, and it can help overcome the human limitations and improve organizational productivity. The impact of this technology, integrating social technology into homes, can provide an added layer of protection by setting up device automation. This will allow primary care providers to check in on individuals remotely. This can increase patient quality of life by enabling them to be more independent, empowered, and connected. These devices can also streamline workflows of care providers to save time and money. Now, what we've seen in practice is that these devices also can create human connection as the devices become more of a talking point when used in a home. Next, we're going to move on to auditory technology.
So auditory technology is also really beneficial for older adults who may have reduced acuity in hearing. Pocket talkers and wireless TV speakers help to amplify the sounds, such as someone talking or a TV show. These are really great for enjoying TV with an older adult because it allows each of you to listen to the show at a volume that is comfortable for each of you.
Now, next, we're going to take a look at immersive technology. So currently what we have available, we have the MetaQuest 2s available. These are virtual reality headsets that let you experience total immersion in another environment by using 3D positional audio, hand tracking, and haptic feedback. These devices are a wireless headset with intuitive controls that have a built-in battery and are easy to set up and understand. Now, these devices will place users into different environments, allow them to try different experiences that they may not have been able to ever try, or allow them to continue trying experiences that they were once able to, but are now restricted by. Alzheimer's Research UK developed a program called A Walk Through Dementia. This is designed to put you in the shoes of someone living with dementia. It uses computer-generated environments and 360-degree video sequences to put you in the shoes of someone living with this condition. It has three different scenarios: at the supermarket, at home, and on the road. On the very left, we can see a device called Rendiver VR. This is a virtual reality program tailored for older adults. It uses live sessions hosted by professionals that take users on different experiences around the world. Now, this can relieve staff of some social event planning and preparation and presentation, as all you have to do is give the residents or the patients the headsets when the event is happening, and they can join. I believe that OSMH is already using these devices, and that they've had some success. Now, looking at the future of these devices, on the left, we can see omnidirectional treadmills. Now, to me personally, I feel like movement is the real only limitation of virtual reality. But these devices will allow the user to move in any direction and have that movement translate in the application. Now, this could help combat the motion sickness that some people experience while in virtual reality, as virtual reality motion sickness is experienced the same way that car sickness is, where your eyes experience movement, but your inner ear doesn't feel it. On the right, we see haptic suits. Now, these are suits that you wear that are designed to simulate the feel sensation when interacting with the virtual world. These can allow individuals to feel what the weather is like while visiting a different part of the world, or even feel the embrace of a loved one far away.
So throughout our time with SGS, we have reviewed vast amounts of current literature, and the major takeaway is that through the use of up-and-coming technologies such as virtual reality and artificial intelligence, society will see a major change in the efficacy and quality of care for older adults. Implementing these new technologies will be wholly beneficial and something you as clinicians need to keep in the forefront of your mind, as it will be increasingly utilized by older adults and care partners. Here I have attached just a few of the research articles highlighting the benefits of virtual reality and artificial intelligence specifically, but I encourage you to read up on these new technological trends. We have compiled all of these research documents into a larger Word doc that will complement our presentation.
Now, it's important that we also consider some of the risks that come with this technology. So when we consider the immersive technologies such as virtual reality, we have to understand the risks such as falls or confusion. It may not be practical to give someone experiencing delirium a virtual reality headset and put them in different environments all the time. Same thing with the pill dispensers. There is always the potential for medication errors. And even interacting with smart home and social technology, there's always the concern of privacy and cybersecurity. So this begs the question, do the risks outweigh the benefits? And personally, I don't think they do. I think that this technology can provide outstanding care and change the way that we deliver our care entirely. But this question is up to you to consider.
So throughout this presentation, it is likely that you recognize a good amount of the technology available to us. This being said, technology is ever changing and is important not only to introduce it into the lives of many older adults, but also catch ourselves up. It will be evident through the use of these devices that we can not only close the digital gap, but we can also foster a stronger sense of connectedness between generations. Throughout my time working alongside older adults, I have yet to see them more excited than when they are using technology to connect with an old friend, grandchild, or family member, as it reminds them of their access to support. Through our program with SGS, we will be able to not only assist older adults with this transition of incorporating more technology in their lives, but also care partners and staff members of long-term care homes and how this technology can ease the strain they experience in their work lives as well.
So just a reminder that we do have a Q&A box. Understandable if maybe there's some questions percolating. I just want to highlight how incredible it's been for us as PRCs to be able to work with Jordan and Nicholas. I really, if you get a chance, please reach out to these two. They have lots of information around technology. What spoke to me in particular for the two of you was when you talked about the impact this has on the people we support. It's, I think all of us who've worked through COVID never imagined how incredible, how much technology would play a role in terms of connecting and that social isolation piece, but also looking at the resilience of the older adults we support and how they're keen, they're interested. And so I think your energy, Jordan and Nicholas, will absolutely have an impact on the folks you support. And so we have added Jordan and Nicholas's email addresses to the chat box for those of you who are interested in reaching out. Oh, I actually, if you can just give me a moment, there are some questions that have come in. Question around those outlets that you mentioned early up. Would the outlets have enough power to shut off stoves? Or is it mainly for household items like lights, etc.?
It depends on the one that you get. Typically, the ones that you'll find in most technology stores are designed for those standard like home devices and just used for a typical outlet. I know that you can find some that have or provide higher output, but you have to find those specifically. Like you won't be able to walk into a Best Buy and find those, but you may be able to find them online.
Excellent, wonderful. There's a couple other questions I'm not sure we have the answers to. Certainly, there's a question around when there's a challenge around using a TV remote, perhaps around cognitive skills in using a TV remote. Not sure if you're able to answer that or speak to that. Is there an option for folks who are not even able to use a TV remote, likely due to a cognitive impairment?
I believe that SGS even has available some TV remotes that can be synced. They are just that's a barrier that's kind of difficult to overcome. The way the devices use now is it's just a simplified version of a general remote that has like less buttons, so it's less confusing to understand. Other than that, I know that some TVs now are moving to voice control, where you can talk to the remote and ask it or tell it what you want to watch or ask it what you want to see, and it can help bring that up. But other than that, that's a pretty untapped category at the moment. Yeah.
Wonderful. Thanks, Nicholas. There is a question here around OHIP funding, and I'm not sure. Thank you for that question. I'm not sure we can answer that. However, what I would like to encourage you to do is to reach out to Nick and Jordan to those email addresses. They have some devices, they have some technology they might be able to work with you on. Another question here quickly, and then I think we'll move on. How do you approach the adoption of these technologies on older populations, and what might be some behavioral or environmental barriers, for example, digital literacy and language, etc.?
I think the biggest part is kind of working top down. So ensuring people who are care partners or employees at the long-term care homes or retirement homes that the older adults are living at have the ability to use these devices themselves, so that they can kind of walk the older adults through, and eventually they may catch on. That would be the idea, but
Absolutely. I think that's an amazing, amazing approach, Jordan. Again, to the two of you, thank you so much. For those of you, please reach out to these two. The future is bright. If this is any representation of the next generation, really appreciate all the work you've done on this. It's been a pleasure. If you don't mind moving to the next slide, please.
Yes.
So as luck would have it, we're in June, and June is Seniors Month, a really important month for all of us on the call. This year's theme is working for seniors, and it's time to recognize the hard work seniors have done for all of us throughout their lives. But it's also a good time to recognize all of you who strive to advocate for our older adults living in North Simcoe, Muskoka. So thank you, everyone on the call. Next slide. As always, we want to highlight, we are running some regional education. What I would like to point in particular your attention to is our upcoming SF Care Learning Series, which will be happening on July 18th. The link to that is being placed into your chat box. And so look forward to possibly having you come to that. It will be virtual. And then next slide. So as always, we will be taking a little bit of a break over the summertime. Really look forward to seeing you all back in September, on September 8th for our next practice short. Topic to be determined. So thank you very much, and all the best.